Welcome to another HACSU vodcast, your Health and Community Services Union. We are joined by State Secretary Robbie Moore, and we're going to do a roundup. We're going to go through all the sectors, what's happening, and what you're fighting for this month. Welcome, Robbie.
Well, thank you very much.
You're going to welcome me.
I was going to welcome you. Well, you're in our office,
I guess
you can welcome you.
I guess it is your office.
Exactly. But no, looking forward to it. There's a lot going on.
There is. So let's cover off on it. Let's start with disability. What's happening there?
Well, disability services, there's a lot going on, and obviously one of the key things we're trying to do at the moment is about making sure that the NDIS issues that are holding back workers and casualising the workforce are addressed. One of the things that we've proposed is a positive registration scheme for workers so that we can get back to seeing employees getting ongoing development and training, which has been restricted since the NDIS came in because there isn't often the funding that there should be for that. So we're asking for a positive registration scheme that would mean workers would have funds available for them to have ongoing training to ensure that they can update all their skills, be recognised as the professionals that they are doing disability support work, which is such vital work for the Tasmanian community. And we want to see this scheme, and we'd like to see it implemented in the near future.
What would that involve?
So we'd see the implementation of a scheme that would see workers having qualifications, and if they didn't have the qualifications, being able to get assistance to make sure that they can get their Cert 3 in disability and community services, and that it would be funded so that they would be funded through the federal government, through the NDIS, to be able to achieve that, but to also get ongoing training each year like many other areas do. APRA do it for allied health professionals, and this would be about professionalising the industry and ensuring that workers are kept up to date with modern practices and continue to develop themselves.
So currently they're not given those options to upskill to... Or is it out of their pocket? Pardon my ignorance. I know you started in disability services yourself, didn't you?
Well, I did. And look, at the moment, it is just a cost burden that's put on employees. So employees have to get a working with vulnerable people check, and often they have to pay for it themselves and their employer refuses. We want to see a more positive scheme, while it would still have some checks and balances and deal with issues if they were raised about employees. It would be a lot more positive, and it would be more about developing people, training them up and giving them all the resources that they need to be able to do their job.
That's great. Let's look at aged care. What's happening there?
Look, there's a lot also happening in aged care, but up front, we're still obviously fighting to get the work value case fully implemented. So this was the decision by the Fair Work Commission to increase wages by up to 28%. And at this stage, only direct care got their 15% in July last year. And the federal government have unfortunately put forward submissions to the Fair Work Commission to delay the further increases for both indirect care and the final instalments for direct care staff till the 1st of January this year, and then for half of it, and then another half in January next year. That's way too late for these workers. We're losing workers from aged care every day. So we've put our submission into the Fair Work Commission demanding that it's paid from the 1st of July, and we're continuing to lobby the federal Labor government and federal politicians to say that you actually should be supporting this, because aged care need that funding and need the increase in wages now so that we can address the workforce shortages.
And we do have a vodcast on that actually, which you'll find on the socials, HACSU socials, with Sharon and Rachel about that very topic. And I tell you what, Sharon, I wouldn't want to mess with her in a dark alley because she's fired up about that, and rightfully so. These people have waited way too long.
Absolutely. And it's great to have Sharon and Rachel on our staff, both worked in aged care, understand the issues, deal with members' issues every day, and know that the workers fought so hard to get this much-needed pay increase. They've been way behind disability workers, for instance. This is a catch-up for aged care workers that's much overdue, and we can't wait any longer. We need that implemented on the 1st of July. The good news is the federal government did include funding in the budget, so that means the money's there. We just need the Fair Work Commission to come forward and make a decision that it should be implemented from the 1st of July.
Has Sharon told you about the bully boss that she had and what she did? Never mind. No, never mind. It's on the podcast, though.
Is it?
Yeah,
No,
it's great.
no, I'm not across that one. I'm sure it isn't her current boss anyway. So
No, it's not a current boss. No, it's an old boss. Let's look at public health. What's going on with public health?
Look, a lot still happening in that space. Obviously, the new government's just been getting into place, and we saw Parliament sit for the first week. We've put all the parties and politicians on notice that we need to see our health system fixed, and we're currently talking to them about what inquiries, but also what actual resources are needed to address that. As we've talked about on previous podcasts, we previously had a inquiry that was going on into the offloading of patients at the hospital. We would like to see that recommenced, but expanded to look at our entire health system and hospital system to ensure that we're dealing with the bed block and the other issues that are caused. And we know a lot of those issues affect all of the workers in the system, whether it's allied health professionals who get people out of hospital sooner or avoid them coming, but all the support staff who do really vital work and could help get people out of hospital sooner too. So the solutions are there. We just want to make sure health workers' voices are being listened to in implementing those changes. Of course, the other part of that is that we've been seeing the implementation of the 1 hour offload procedure for ambulance and for paramedics. And we're seeing an interesting situation where it's going really well in the north of the state. The Northwest Regional Hospital leading the way. Mersey's doing quite well. LGH not quite as well, but doing a lot better. The big problem we're seeing where we're breaching the 1 hour protocol is at the Royal, and we're currently trying to work really closely with hospital management and ambulance management to resolve those issues. But it has been a positive step. Our members are quite positive that we can get there, but it's still more work to do, especially here in the south of the state.
Well, yeah, because you've got the emergency department and making beds and rooms and staff available, right, for the offloading to work.
That's right. And one of the fundamental issues that has never been dealt with by this government is the fact that when we say there's a bed shortage, there literally isn't, because they actually have physical beds. They don't have the staff to employ people so that those beds can open up. So, and the reason they don't have the staff is we have huge issues in Tasmania with recruitment and retention of allied health professionals, doctors and nurses. So we need to see a recruitment and retainment strategy of this government of allied health professionals, doctors and nurses and other staff, and then we can open up more beds and actually fix this bed block issue, which can alleviate ambulance ramping as well.
And that's something we've seen in private health too, and most recently with the Hobart Clinic, the beds are available, but the staff's not because they've been leaving in droves. What's the latest with the clinic and also any other issues within private health?
Look, Hobart Clinic, the dispute, there has been a recent development. This has been such a tough fight for these nurses. These are the workers that were actually told by the Fair Work Commission that they couldn't even wear a badge, which was just a ridiculous decision. But they kept fighting. They got up a new ballot to take industrial action, and as a result of that, Hobart Clinic have now come to them with a new revised offer that's much improved. It's not perfect, so we're still trying to improve it a bit more. But look, I think we are going to be able to get somewhere, and it finally looks like the CEO has most probably been overruled by the board, and we've finally got light at the end of the tunnel and a solution there that will see those nurses win a decent, much-deserved pay rise.
That is amazing, Robbie.
Just goes to show what can happen when workers stick together. And
it's actually giving me goosebumps because, speaking with, and I'm not meaning to do plug after plug for the podcast and podcast, but we spoke with a lot of patients that really were at their wits' end. They didn't know where to go, what they were going to do. And that's something that I know weighed heavily on a lot of people here at HACSU and myself included. But that is just really a real big positive step.
Oh, it's huge, and it's good that you've mentioned that, because we'd love to do a community event when this is resolved to thank all the patients that were so fantastic and their family members who really did get out there, and the support from the community was overwhelming. Thank you for the work you did as well. And we want to celebrate this victory because it's been done by the community and by those nurses fighting for such a long time, but they're going to get there.
That's fantastic. Community services.
Yeah, look, there's a lot going on in community services, both public and private. Obviously, the big news that's been in the last week or so has been around Ashley Youth Detention Centre. We've got an unprecedented thing, or at least in the last 10 years, we've got 26 children in the Ashley Youth Detention Centre. Look, we need to reflect on this as a community. How can it be that we need to lock up 26 Tasmanian children? Something's going wrong in the system. We can't blame kids. What we've got to do is work out how the system is failing these children and look at ways to look at therapeutic care, ways that can avoid people needing to go into a detention centre where you're going to be spending time in the worst possible environment. We know the rate of people that go to Ashley that end up in Risdon is, shocking. It's around 90%. That's just totally unacceptable. We need to overhaul and prioritise Tasmanians' children, and to do that, we need to look at positive schemes that look at helping the kids who are most vulnerable and how we can avoid them coming near the criminal system, and instead look at programs to give them opportunities, to give them hope, education and employment. We know those things are the solutions, and we need to focus more on that rather than just locking people up.
What kind of rehabilitation do you know that they have in Ashley? Do they have any? Is it...
Yeah, well, the staff there do provide really good therapeutic care, and I often hear from members at Ashley who are so disappointed where a child spends some time with them, they spend a lot of time rehabilitating them, give them all the support, but then they're so disappointed to see the kid come back 18 months later, mainly because the kid wasn't given the support once they left Ashley.
Got you.
So, the staff are absolutely on board. They don't want these children in that centre either. And we've just got to look at a program that obviously looks at how we avoid people ending up there in the first place. If they do end up there, how are we going to support them for years to come to make sure they don't end up back there or in Risdon, and that they're actually productive in our community, in our education system, in our workforce, and living the best possible lives that they can live. So we can be positive about that. We know that, unfortunately, the government and Felix Alex likes to say he's, tough on crime. That's a failed approach. It hasn't worked anywhere in the world, and it's just political populist sort of lines. And his lines and the government and the Premier should be intervening to say that's not what we're about. We're not about locking up children. We're about providing care, therapeutic support to young people, and about improving people's lives.
Robbie Moore, State Secretary for the Health and Community Services Union, the largest in Tassie. Thank you so much for that update, that member update. And I love that we're going to be doing this every month. So thank you.
Thanks so much, Esther.